This case study is about endometrial polyps in canine. It's a case study about 9-year-old beagle from Theriogenology question of the month. A 9-year-old beagle was presented for pregnancy diagnosis. The breeding was coincided with the peak concentration of luteinizing hormone. As we all know, there are two methods of determining the exact date of parturition. First is measuring the concentration of luteinizing hormone, and second is determining about the distress period. This bitch had multiple litters before with normal whelping. No vaginal discharge was observed in this case. Upon physical examination, a discrete ovoid mass in mid-abdomen was palpated. Upon ultrasound examination, a large mass containing multiple cysts in it with clear fluid was observed. Here is the ultrasound of the bitch. It is multiloculated mass with multiple cysts in it, which are about 2 to 5 millimeter in size, and this mass is itself 3 to 3.5 centimeter in length and dimension. The bitch was euthanized 30 days later after the ultrasound examination. Thus, the tract showing here that there is enlargement of the left uterine horn. It's an endometrial growth near the bifurcation of the horns. Upon histological examination, it was confirmed that it's a case of endometrial polyp because only endometrial glands and stoma was involved. Talking about the differential diagnosis of this case, it can be pregnancy itself, it can be endometrial hyperplasia, chronic pyometra, adenomyosis, neoplasia. The bitch was euthanized and a clear mass of about 3 to 3.5 centimeter from endometrium was observed. Uterine lumen contained a very small quantity of the mucus and myometrium was not involved. Talking about what an endometrial polyp is, it's a solitary proliferative growth from endometrium. It is benign and they are localized. There are no chances of malignancy. It can proliferate and it can occupy the overall lumen. What are the causes of endometrial polyps to develop? It can be due to continuous stimulation from estrogen. It can be due to cystic endometrial hyperplasia. They can also develop secondary to the cystic ovaries. In rare cases, the endometrial polyps may proliferate from cervical canal into the vagina, and they are benign. They can be of two types. It can be broad-based sessile mass, or they can be pedunculated, in which the polyp will be attached with a stalk. How is it different from pregnancy? In pregnancy, there will be fetus itself or the fetal structures will be present. How polyps and pseudocases or phantom or false pregnancy be differentiated? They can be unusual circumferential hyperplasia, but we know that upon histological examination, the endometrial changes will be identical to the endometrial changes present beneath the zonary attachment of placenta and gravid horn. So these are different. Talking about adenomyosis, they are the growth, proliferations of endometrial glands into the myometrium. They are focal, but they are deep embedded cysts. Mm, Talking about chronic pyometra, really they can appear as segmental enlargement, and ultrasonic examination would be different for adenomyosis and also for chronic pyometra. The neoplasia in the reproductive tract of bitches are very uncommon. Leiomyomas, they are single serosal attachments, they are demarcated. Very rare are lymphosarcoma, hemangiosarcomas, and fibrosarcomas. Talking about what could be the treatment of choice observing any abnormality in the reproductive tract, obviously it's ovariohysterectomy, but if the bitch is of breeding importance, it can be ligation of uterine horn and ipsilateral ovary. Thank you very much.